All right, I think in the interest of time, we'll get started just because we have to finish right on time to let you go to your next session. So again, hello everyone, and thank you for being with us today. And my name is Vlad Kovalevsky. I'm a program manager at the Global Disaster Preparedness Center. And thank you for joining us for our session that's titled "What Makes Alerts Work: Advancing Inclusive and Effective Early Warning Systems Through Research and Innovation." And why this topic, you might ask? But early warnings are among the most proven and effective ways to reduce disaster impacts. But unfortunately, over 30% of global population still are not covered by early warnings. And as we know, and as we see many examples, even when early warning systems exist, they often fail to reach the most marginalized and vulnerable people. And at GDPC, we've been working for a number of years now to kind of further to support building evidence about early warning, and especially early warning for inclusive early warning, and also develop various solutions that can improve efficiency and inclusivity of early warnings. And today, today's session is kind of all about that, bringing together different research insights and also examples and ideas of how we can make early warnings more inclusive and effective. And just to confirm that you see my screen, or yes, my presentation sounds good. And before we begin, just like a couple of housekeeping notes. We have people from all around the world. So if you would like, just feel free to introduce yourself in the chat. Send us your name, your organization, and where you are joining us from. We'd like to know how many people from what organizations joining us today. And then, during the session, we would like to ask you to keep your microphone off, just, to avoid any interruptions. And, if you have any questions, again, we'll start with presentations by our speakers, but then we'll have hopefully enough time for questions and discussion at the end. So, when we get to that part, feel free to drop your questions in the chat, or if you prefer, just raise your hand and, unmute and, speak up. And then after the session, we'll have like a really short evaluation survey that I will ask you to fill out to provide your feedback about the session and then the event in general. And then if you have any IT troubles, feel free to send a message in the chat, and our admin people will help you. And then just so that the session has been recorded, and the recording will be shared afterwards. And just wanted to make sure that's okay with you. And and also, if you prefer to listen to this presentation in a language other than English, there is AI-generated caption and translation feature in Zoom. So if you go down to your screen, there should be show captions button, and that's how you can turn on translation in other languages that you might prefer. So thank you for all our speakers. We assembled a really exciting panel of speakers today, both researchers and practitioners who will explore different barriers to effective early warning systems, and also share some solutions and recommendations that came out from their research, but also tools and resources that they're working on. And we would like to start with spotlighting a few researchers who were supported by our small research grants program. A couple of years ago, we launched a research initiative focused on early warning and early action for last mile communities. And by last mile, we mean communities both kind of socially marginalized and also geographically remote, those who are like hardest to reach, and those who are usually are not covered by early warning systems. And we supported around 15 researchers from across 14 countries focusing on various communities like persons with disabilities, ethnic minorities, urban slum dwellers, people living in extreme poverty, and so on and so on. And today we're really excited to share, to have a few researchers with us to share, findings from their works and from their work and some recommendations that came out. And without further ado, I would like to hand it over to our first presenter, Rafael Pereira from University College Cork in Ireland, who did his study in Brazil, focusing on traditional coastal communities. I don't know, Rafael, are you here with us? Um, okay, I think maybe he's running a little late. I don't know if Tara, you can go first, maybe.
Thank you, Vlad. I can, if you, yeah.
Yeah. Okay. We'll start with another researcher, Tara Balav Adihakiri who did his research in Nepal, focusing its very kind of interesting perspective at the intersection of public health and disaster management, looking at early warning kind of considerations for people living with non-communicable disease. And Tara, what were some of the barriers and unmet needs that this group faces in acting in on early warning messages, and how is it different from general population? And also maybe you can talk about different solutions of recommendations that came out of your research that help better address those needs and early warning and early action.
Okay, thank you, Vlad. I'll start with sharing my screen. Can you see my screen?
Yes.
Yes.
Okay.
Thank you, Vlad. And hello, everyone. As Vlad said, my name is Tara Ballavadikari. I'm from Nepal, and I did my research in Nepal, but I'm currently based in Denmark, working as a postdoctoral researcher in Center for Global Health at Aarhus University. As Vlad briefly introduced already, like in this presentation, I'll briefly share why early warnings often fall short for the people living with NCDs in disaster-prone areas of Nepal. Yeah. So a brief background just to introduce what we have done. Nepal, it's a South Asian country between India and China. It is highly disaster prone, especially to flood and landslide. In the recent ranking of Global Climate Risk Index, it's ranked 69th, but in the previous years, it was among top 10 and top 20. So the recent ranking has been widely questioned by the experts, given the country's frequent severe natural disasters. At the same time, Nepal, it's facing a growing burden of non-communicable diseases. As you can see from this chart, that non-communicable disease accounts for more than 70% of all deaths, and the prevalence is equally prevalent. So here non-communicable disease, for those who are not in the field of health or science, it's cardiovascular disease, the disease of hearts, disease of lungs, cancer, and diabetes. These are the major NCDs in Nepal. So despite this intersection of this disaster and growing burden of NCDs, the early warning systems in Nepal, it's largely generic, like often failing to consider this reality of changing epidemiology or the changing burden of disease, meaning that the major share of populations are either affected by NCDs or living with NCDs in Nepal. Unlike, as Vlad has asked, unlike why this population is unique, unlike this general population, the people living with NCDs, they need more time, they need clear guidance, and support to act, especially during the time of disaster, because they rely on regular medication, care, and have majority of them limited mobility, and they need the uninterrupted care and to access and services. A brief introduction, what was the method that we employed. The purpose of this study was to understand the barriers and experiences and suggestions related to early warning messages during floods, specifically from the perspective of people living with NCDs. We conducted the study in 2 flood-prone municipalities in Nepal's far west lowland. And this is qualitative study that was carried out in August to October of last year, 2024, using focus group discussion and interviews. So we identified several recurring barriers from our interview. We conducted this among the people living in NCDs and local stakeholders. So we tried to explore like what was the things or the barriers that prevent people living with NCDs from receiving or understanding or acting on early warning message. So I'll briefly walk through those now. One of the most common barriers raised was the timing of early warning messages. Many participants said that alerts arrived only after flooding has already started. For people with NCDs, this delay can be critical. They lose the chance to prepare, gather medication or essentials, and also safely relocate. In addition, the messages are often too generic. That means that they do not include any health-specific advice or support, which leaves people confused and unprepared. As one participant said that I have not received a message before the rainfall yet. And another said that message just say it's coming, but offers nothing supportive to my condition. Another barrier is language and literacy. Most early warning messages are sent in the Nepali, the common language, which excludes the large group who speak the local language in particular study settings, that's Tharu and Achami. Even when people receive this message, many, especially like older or less illiterate individuals, cannot read it or use their phones to access this information. One of the participants mentioned that I do not know how to use the phone and read the message. Other also noted that the message in the local language would be far more effective. Other key barrier that we mapped is the lack of community involvement in early warning system. People living with NCDs and other residents are rarely consulted or included in the design and the delivery of the messages. As a result, there's a little awareness or ownership of the system, which ultimately weakens the trust, reduces the chances of the people to act on the alerts. And one of the key informant told us that I have never, or she have never heard or seen community people being involved in the discussions regarding early warning system. So without community input, the messages often they may remain irrelevant, disconnected, or confusing to the people they are meant to help. So during the floods, physical access to the essential services, including hospitals, healthcare systems, pharmacies, or the government services is often cut off. For people with NCDs, even a short interruption in care or medication can have a serious or lethal consequences. As one of the participants explained, they cannot reach hospital due to the road blockage. Or the pharmacies. This shows how early warning system also must go beyond just the hazard alerts and account for access to care, or especially targeting to those last mile communities or people living with chronic conditions. And the lack of trust is the another things that we map. Even when messages do arrive, many people no longer trust them because the repeated false alarms have made communities skeptical of the warnings they receive. Some said they received warnings, but saw no actual flooding. And over the time, they started ignoring them altogether. So one participant put it simply, we stopped paying attention after hearing the same warning that never matched what happened. So this erosion of trust makes it even harder for early warnings to lead to protective action, especially among people who already face barriers due to their health conditions, like people living with NCDs. So these barriers have a real consequences. For people with NCD, missed or delayed warnings means they simply do not have time to evacuate or prepare medication or essentials. Flooding often leads to stockouts of medicine, road blockades, and closed clinics or hospitals, disrupting access to care. Many reported skipping doses of medicines or losing the follow-up entirely during the disaster. The psychological toll is also significant. The uncertainty and the lack of preparedness lead to fear, stress, and anxieties. And families often that's focus on saving property rather than ensuring the continuity of the care and treatment. And finally, people with NCD are rarely included in the planning. Their needs are often invisible in early warning strategies, drills, and policies. So based on these findings, we identified or mapped 5 areas of actions to make early warning systems more inclusive for people with NCD. First, we need to make warnings timely and actionable. Alerts must come early enough for the people to prepare and including clear and simple health-related guidance. Second, we need to communicate in local languages and formats like SMS should be complemented by the loudspeakers or the community radio or direct calls, or if considering the context of the locality. Third, engage communities in planning. People living with NCDs and health volunteers must be part of designing the message and strategies, and this will also help to build the trust. Fourth, we need to integrate health into disaster preparedness. That includes stocking of medicines or ensuring mobile or backup care or many other options when access is disrupted. Finally, we need to prioritize trust. We need to use consistent, relevant messaging and known messengers like local health workers, local leaders to restore the faith into the system. So a bit of acknowledgement. I want to sincerely thank these community members, health workers, and local people of the study area. Special thanks to the people living with NCDs who generously shared their stories and insights. I'd like to thank Nepal Red Cross Society for their support in the field coordination, the Danish Red Cross, Canadian Red Cross team in Nepal for their technical input and collaboration. This study was made possible through the funding from Global Disaster Preparedness Center. So I'd like to thank the GDPC for funding this project. And finally, I'd like to acknowledge the dedicated research team for bringing this rich and very important data. Thank you all for your attention. If you want to go in detail of our study report is online in GDPC website. You can scan the QR code for the report. So I welcome any questions, reflections you may have, and I'd also love to hear thoughts on how we can make early warning system more inclusive for those at most at risk, like people living with NCDs. Thank you.
Thank you, Tara, and thank you for your impeccable timing. If you have any questions to Tara, please remember them, and you'll have a chance to ask them at the end. And next, we'll hear from other researcher who participated in our small research grants program. Alumuyiwa Adegan from Federal University of Technology in Akure in Nigeria. And he focused on heat early warnings among people living in informal settlements. We all know that extreme heat is becoming increasingly more dangerous, and people who live in informal settlements are especially impacted and at risk of heat risks. So he unfortunately had some connection issues, but he sent me a recording of his presentation, and we're gonna watch it right now. But he'll be around for questions. So again, if you have any, if you think of any questions to Alamuyuwa, make sure you remember it, and you'll get a chance to ask later.
Hello. Thanks, Vlad, for this opportunity to share our work. Good morning, good afternoon, good evening. Secondary city, you might say, and Lagos, which is the mega city, the biggest city.
Do you
with
hear the sound?
a lot of people
No.
and commerce.
Yes, we do.
So, slums and informal settlements contain disadvantaged and at-risk people, a lot of poor people who are evidence of socioeconomic inequalities in our cities. But beyond the socioeconomy, they also experience a lot of climate impacts, extreme exposure to extreme temperature, and they are the last mile. They are of information, in terms of access to resources, and a couple of other issues, since they're excluded from the formal system. So there's need for community-based early warning. And this work where we looked at utilizing early warning resources, identifying actions, barriers, and preferences in the context of community early warning systems. So we actually had three parts in this work. So we first access the utilization of existing heat weather information, including those from meteorological agencies and other sources. And in this part, we did the community survey in the two locations, and we also had focus group discussions in the two locations, in the two communities where we worked. So the survey also helped us to get a database of residents who would like to get alerts for what we propose to do in the next part. So in this part, which is the part where we developed the heat warning system, so we had to process weather data, the next day weather data, we had to get that, and we had to calculate the heat index. Based on the heat index, we circulated alerts to residents in terms of the expected heat index and the preventative actions that they ought to take. So we did this for 39 days, and the alerts went in English and the local language. And we had over 300 residents who had signed up and who received this, who were sent this SMS. So what you can see here is the heat index, which we used in circulating the information when there was no risk, when you had less than 29, and extreme X when you had greater than 45. So the last part was the feedback session. So we had, after deploying and disseminating, we also had a session to get feedback of the residents in terms of the information received. So I'll briefly talk about what we found through the survey, looking at utilization of existing heat warning information. The knowledge systems is low. The knowledge of heat information is low. I mean, we could rank that only 38% of the respondents, the residents, had accessed or engaged existing heat warning information, heat weather information. And the factors that influence the level of awareness are understanding, whether they understood the message, the language used, the availability of the message, and then the mode of technology. So these are some of the factors that influenced the level of utilization. We also checked if they had even taken, at any point, taken any action based on this heat weather information, and for most it's no. Across both cities, it's no, they've not taken any such information. And some of these inactions are linked to a couple of issues. I mean, topmost of which is not fully believing in the forecast. So some feel it's not even possible to forecast what would happen. Only God decides what happened, and then they really don't believe in the forecast. They feel it's not accurate, so why should they believe it? But the other main reason, the other reason we also identified was socioeconomic. So even when people receive the information, because of the prayer of making a living, they don't take any action based on the information. So they need to go out to work to make money, and most of these people work in the informal sector, they earn on daily basis. So if because of it you don't go out to work, you also don't eat. So they don't take actions because they need to make a living. In the survey, we also found out the preferences. So what modes would the residents prefer to receive this information? And the topmost is radio, in-person, and SMS. We also analyzed to find the factors that influence the preferences. And then the two factors are age and educational level. So older people want more printed telephone radio means, while younger ones want SMS and email, which also links up to the aspect of education, because the more educated ones wanted more digital channels, SMS, emails, whereas the people who had lower education want the more in-person communication, your media, your telephone calls. So we also checked on the groups that should receive the information if it's to be disseminated, and they align with a lot of vulnerable groups: parents of infants, the elderly, those who are physically challenged, and all that. So after deploying the EAT alerts for 39 days, we did this feedback session, and we did it through focus group discussion and interviews with those who had received the alert. And of course, they confirmed release of the EAT alerts, they confirmed its usefulness, but some mentioned that they almost got fatigued because they got about the same information over days, and they feel this information has come again of what uses these, it's getting too much, it's just the same thing. And alert fatigue is a very critical issue in early warning systems. Those who don't understand sought clarification from those who understood the information, and some took some actions. It's heartwarming. Some took actions based on the information we circulated, and they had testimonies of how they changed the way they drank water, hydration, the way they dressed, wearing lighter clothing, having more showers, changing their diet. Some reported taking more fruit, and their activity pattern, trying to avoid the sun because of extreme temperature. And of course, these changes led to some improvements in their health, as some of these interview excerpts show. So we also checked on the suggestion on how to improve this dissemination. So they wanted us to include radio. We had only used the SMS, and we did put up some posters, but they felt it's good to also add the radio to it, and to have some community sensitization events, activities within the communities, and also to expand the languages used, so that people who don't just who can get it better in the other languages could find the information useful. And of course, they felt it's useful for their community, and we need to reach more communities. So it's highlighting the need to scale this EAT warning information within informal communities. Now, the lessons we learned, the key lessons are that yes, this was widely accepted within the communities, and it highlights the potential of bottom-up innovation in terms of EAT warning dissemination. But we found that beyond telling people what to do when there's extreme temperature, there's need to provide basic services. And these are slums and informal settlements these are underserved areas. So there's need to put up those basic services in terms of water, in terms of electricity, in terms of health facilities, which would of course help to build resilience. We also identified the need to leverage technology. I mean, what we did at some very significant part that were manual, so it's very important to use to automate it, from the weather monitoring to the EAT index calculation to the dissemination, and even to the feedback. So there's a need to automate all these processes, and I know there are technologies to do this, and the language factor is also very critical. So it's good. We're excited about this work. We look forward to your comments, and we look forward to your collaborations to see how we can also scale this. I'm happy to engage more in the Q&A session. Thank you.
All right. Well, thanks, Alamuyiwa. As I said, if you think of any questions, he should be around for Q&A part afterwards. So make sure you remember them, and you'll have a chance to ask. And now from Nigeria, we'll virtually travel to Brazil, and I would like to invite Rafael Pereira, who is currently pursuing his PhD at University College Cork in Ireland, but at the time he worked at the National Center for Monitoring and Early Warning of Natural Disasters in Brazil, and did his research and focused his research on traditional coastal communities in Brazil. And as part of his research, led to the development of a prototype for a more inclusive and community Community Center, Risk Communication and Early Warning Systems. And Raphael, I would like to ask you, maybe you can tell us more about this prototype, like what does it look like? What were some of the key results and insights that emerged from developing and piloting this prototype with the communities?
Okay, Vlad, so now we have where to start. Thanks. Do you hear me well?
Yes,
Yeah,
we hear you.
So I will present my screen and I promise I will reach to this point where I explain the prototype, okay?
That's good. Luis, maybe you can give Raphael the rights to share his screen.
Sorry, I just made you co-host, Raphael, so you should be able to share your screen now.
Okay, did
We
you
saw
see
it
for
for
a moment and it's gone?
now it's gone. Yeah, we saw it for a second before.
Again.
Oh, yeah, now we see it.
Okay, perfect. Can you see my notes as well?
Now we see the
Perfect. That's
next
perfect.
one. Yeah.
So yeah, first, thanks a lot for the opportunity. I'll try to finish the presentation timely, okay? So as you can see in the title of the project, this initiative focuses on how can we ensure that early warning systems is not going to left anyone behind during disasters. And we are talking particularly about groups historically excluded from the system due to systemic inequalities. Over the past 7 years, I have been collaborating with local communities to address these gaps. And in this project, I collaborated with two remarkable communities I would like to highlight. The first is a fishing community, and the second one is a Quilombo community. I think you're not familiar with the concept of Quilombo, but it's a legally protected territory inhabited by descendants of enslaved people who reclaimed these lands as spaces of resistance and cultural preservation. So it's one of the several traditional communities residing in Brazil. And as you can see in these maps, yeah, you can see the map. In the left panel, in the left, you can see a location map with the fishing community and also with the Quilombo community. The fishing community is in the north of the coastal area of São Paulo state, and the Quilombo community is in the south of Rio de Janeiro. And both of them share the same environmental context. So they are located in the Brazilian Green Coast, which is a biodiverse region and also with a high susceptibility of mass movements. So there's a lot of occurrences of landslides there. This region was chosen to the study because of the history of impacts related to extreme floods, landslides, sea level rise, and strong winds. And also, there's a study that says that this region has at least one major disaster annually over the past 5 years. And more recently, in February of 2023, a landslide caused by a record-breaking rainstorm of more than 600 millimeters in 24 hours left 64 people deaths. And that's the type of events we are dealing with in this Green Coast region because of climate change, but also because of unplanned occupation of urban space. So, well, in Brazil, we have an early warning system in place, a national structure But at the same time, local authorities, they have the autonomy to send alerts to the citizens inside their municipalities. And the truth is that people don't really know what early warnings, what are the early warnings. So I have been working with these local communities for a while, and we asked the same question in the last 5 years. Do you get warnings? The majority says no, I want to receive it. And when people say yes, I receive warnings, we ask them if they know what to do with that information. And the answer is no, I don't. So that's the actionability problem. And we aim to understand why it happens, whether people receive warnings, and who is left behind. What are the barriers to disseminate the warnings, and how can we overcome them to put people at the center of the early warning systems? That's the main idea. For that, we chose intersectional framework, and we designed it thinking that vulnerability is not evenly distributed, and climate change impacts do not strike people the same way. So by using this framework, we wanted to move from a hazard-centric approach and focus on vulnerability to ensure that critical information about disasters will reach everyone timely. And we have such a big social diverse society in Brazil, so it's really hard to propose comprehensive measures that will really reach everyone. That's why we need more studies like this. And we had the support of a big group of community leaders, researchers, local authorities, even policymakers working with us. And we met every month to plan and discuss and prepare the assessments of the project. I was abroad at the time, and I was more working with the coordination team, but you can see here a few pictures without me in the fieldwork. So in these pictures, you can see the team of the household survey, the storytelling activities, and I think I jumped to one important one. Yeah, this one. We also carried a lot of workshops, participatory mapping, meetings with civil defense authorities, and yeah, a lot of methods combined. And the key findings show that there is actually a priority group for sending early warnings in both territories. The key find is that looking into the demographic data, we could see that a lot, more than 5 in every 10 inhabitants of both territories are under 19 years. So school-age children and youth, they are the majority in both areas. Both territories have really young populations, and that's a characteristic of traditional territories, but also informal settlements in the country. And we also mapped people with disabilities in both territories, the elderly, and those in remote areas, groups that would need help to protect themselves during emergency situations. And we also understand that women in the territory have a lot to do and a lot of burdens. So they are already handling a lot of responsibilities related with running their households, community management positions, reproductive and productive roles, as we know. And if a disaster strikes in this territory where the population is really young, they would be even more overwhelmed. So this is one of the findings for both areas. And each of the groups I mentioned before is more likely to struggle when dealing with severe weather events for different reasons. For example, children cannot go outside without an adult to watch them, or older people might have trouble using technology. People with mobility impairments would struggle to get to safe places during a rainstorm. So there's a lot to address when designing comprehensive measures to protect two communities. More findings show that regarding the communication, the information about the events only reached the communities after the disaster. So that same pattern that we observed in other case studies, it remains here. Like We don't have the yes answers for receiving warnings. We only have that, no, I don't receive warnings, but I want to receive them. But the problem is the next stage, as we already know, is they will receive the warnings and they are not going to understand and know what to do after the warning, the local warning system is in place. Thanks, Vlad. And the community networks in the territory also fail during emergencies, so they are not reliable. And there is a lack of clear differentiation between official warnings and misinformation. So we need local communities to validate and reinforce warnings sent by authorities. Otherwise, they wouldn't be trust. But that's another problem we found. And now I have the prototype. To solve that problem of people don't really know where to begin when starting to develop a early warning system based on the community, we just try to propose a prototype as a tool to facilitate a step-by-step of where to begin. So now you know where to start. And now we have trying to run this prototype in different places. And we understand that for each community is going to be different. For each community, we have to implement considering another group or considering another barriers for the communication. So what we want to do with this prototype now is enhance it for every community where we work. And that's why we need the local groups to work with us to try to make it better and sophisticate, because I think it's a social technology, but it's just the beginning. It's just the baseline we need to develop community-based early warning systems in traditional territories. And my time is up, so I'm sorry. And thanks for the opportunity again.
Yeah, thank you very much, Rafael. Indeed, very interesting and important findings, especially related to trust and misinformation and how can it fuel even more chaos and panic during the disasters. And now, as I mentioned earlier, GDPC is not only involved in kind of helping build this evidence, the evidence based around early warning, but we also supported various innovation solutions and approaches to help improve early warning areas. And now I would like to invite Paola Gela from IFRC, Information Management and Data Science Officer at IFRC, talk a little bit about the IFRC Alert Hub that was supported by GDPC. It's a tool, a platform that is designed to make emergency alerts more timely, clear, understandable, and accessible. And Paola, can you tell us more about what is IFRC Alert Hub and what makes it innovative and so important, how it can help improve alerts delivery?
Thank you, Vlad, and thank you for the invitation and for being. It's very nice to be able to hear all the researchers from that very nice post that you did on this last mile research of. So thank you. So can we please go to the next slide? So the Alert Hub platform is a platform that aggregates official alerts from different meteorological agencies and some disaster management also entities in a single place. And it allows you to subscribe to alerts via email or also to access the data here, like in a map, as you can see it, or via an API so that you can do kind of more analysis at the scale. Thank you. I'm kind of zooming out, so that's specifically the tool. You have the link in the chat. But what is the context? And by one part, we have we have all the evidence that we have just heard, but we have also this World Risk Poll report from last year, in which they did a large survey for those persons that and they asked for to those persons that have experienced at least a disaster in the last 5 years, and for that group, 54% of persons that own a phone with internet didn't receive an alert. Also, we got that 35% of persons in rural areas didn't receive an alert. Just like facts. And 11% of persons do not own a phone. So we have that kind of landscape. And by the other hand, we have this statement that from the Early Warnings for All initiative, in which we want to ensure that everyone on Earth is protected by life-saving early warning systems by 2027. So we have this kind of evidence of what is happening just until last year, and then this kind of ambitious goal that we have for 2 years from now. So if that's the situation, we tried to kind of simplify a lot. So sorry if here we are generalizing a bit, but what are these two axes? And one part is connectivity, right? So if you are in some countries, for example, in Europe, many countries have already this cell broadcast. So even if you don't have internet, this alert will arrive to your phone, and yeah, it's going to arrive. Or in some other countries, there are these SMS services that it can arrive, but we know that that's not the case for all the countries. That's just where there is more connectivity, and that happens even if you are kind of eagerly searching for alerts or not. It just kind of comes to you. If you're of the other side of kind of users or persons that are more actively searching for alerts, maybe you have this alerting app that the different agencies in your country have for alerting the population. So there are different behaviors, kind of more active or more passive, and different scenarios where you have more connectivity or less connectivity. And yeah, kind of one, I think we also read in some research that some place in which part of, many people receive alerts is actually from their family and friends and community that actually kind of get access to this information. So thank you. So the Alert Hub is based on just authoritative sources. And those authoritative sources create alerts that are in a standard format. And that format was agreed like around 20 years ago, trying to have just the minimum of things that were necessary, but that could be kind of a standard in a global manner. And why they did it like that, why they thought that was a good idea to have that standard format, because then they will be able to disseminate different type of channels. So for example, in the next slide, we will be kind of seeing more details. For example, Meteo France is the alerting authority for meteo alerts from France. They have this type of format so that different services can get their alerts and share it with the public. We are getting as well alerts, for example, from NOAA, from INMET, from NIMET, these different agencies. And one part is the cell broadcast that is just kind of giving this message in your phone, even if you don't have internet. Another type of distributor of these alerts is Google. Google has a service, I think, that is called Google Public Alerts. And because this alert is in this format that they can recognize and they can understand, they display these alerts in Google Maps and in Google Search if you are within the area that is exposed to the hazard. And the IFRC Alert Hub is one of those dissemination channels. So again, it's a platform that you can find online. The input is kind of all this list of sources or this list of alerting authorities that we have around the globe, the ones that are using CAP or this format. And what does it kind of give to you? You can see their active alerts, historic alerts, you can access the API. And at the moment we have a subscription that is really not for alerting, it's more for situational awareness because it's just via email and you receive a kind of at most one thread of messages of alerts per day. But yeah, that's what it is offering at the moment. So when we say of this format of alert, what does it have? What does it has? By one part, it has date, like when the alert starts, when it ends, which is the urgency, certainty, and severity, which is the location, the type of hazard, the source name, and more importantly for us, as you said, instructions, right? Like those messages that are actionable. That's where they should be to this format. So we have this platform. You can go there, you can see in the map the active alerts, you can see the historical alerts. And with that historical alerts, because we are in RC3 and we have kind of this interest on research, you can do analysis at the scale. And for example, see how different alerting authorities communicate their alerts. So here, I touched on some of the points that were kind of mentioned on alert fatigue and what happens when maybe some alerting authority puts like a high severity all the time. So this type of analysis can be done, and ideally with this analysis, our national societies will be more empowered to talk with their alerting authorities to improve the messaging. Yeah, this one as well, like which are the languages that are used on these alerts. So here as well, we can also talk on how can this be expanded. And next slide, in the instructions, because we have this historical data, we can see some countries, which messages they are creating for the general public. And first, just kind of, we hope that national societies can talk with the alerting authorities to try to make them more actionable. And in the long term, imagining how can those instructions be targeted for a specific group so that it is even more actionable. Okay, maybe too much, but zooming out, this is kind of our vision. We understand that the Alert Hub platform will just target, it will have just a small reach, right? Those ones that know that the platform exists and that have connectivity to go there. But our vision is that imagine that all the branches from our different national societies can have access to their alerts. So ideally, that will make that they can access in a more timely manner those alerts. As soon as they are created, they can see them, because you can see not only at country level, but you can see at subnational level. So that's kind of, and then the volunteers can tell to the community. So yeah, that's the vision. Thank you.
Thank you very much, Paola. Yeah, I highly recommend you all to go check out Alert Hub. It's an amazing kind of tool that aggregates, as Paola said, all the different alerts and can, be used by Red Cross national societies and by other community-based organizations to see the alerts that have been issued in their country or like their kind of locality and, disseminate them further to communities. Thank you again, Paola. And now we're moving on to my colleague Rita Ewing, who is gonna tell us a little bit about public education, public awareness and public education messages. Again, one of the key challenges with alerts and early warning that oftentimes they're not actionable. So people know that the threat is coming, but they don't always know what to do about it. And PAPE is a tool that kind of helps address it. Rita, over to you.
Can you see my screen?
Yes.
Okay, excellent. I don't have slides to share. I have one slide to share. So hopefully this is a good illustration of what I will be talking about today. But hello, everyone. My name is Rita Ewing, and I am the Design and Implementation Program Manager for the Global Disaster Preparedness Center, GDPC. And I hold our PAPE portfolio, so that's why I'm very honored and excited to be able to speak to you all today. To kind of set the scene, I'd like to start off with a really quick and silly personal anecdote that I think captures the essence of PAPE and what now and the importance of actionable safety messaging. So when I was around 16 or 17 years old, I had saved up and I got my first car. It was a total rundown mess, but it was mine and I was very excited about it. So my friends and I, we decided to be a little bit naughty and take an hour-long drive up to the city against my mom's knowing. And so it started off as a really beautiful spring day. We were driving around, exploring new sites, But then very quickly, the weather turned, the clouds turned really dark and heavy, and it started to absolutely pour on us. And then almost immediately after that, my friends and I all got alerts sent to our phones with capital letters saying, "Warning, flash flood, move to high ground immediately." So obviously, not familiar with the area. I had no idea where to go to safety or really what to do. And so I was panicked, but luckily we made it home back without any incidents. But it's truly a memory and feeling that stayed with me. So what good is a warning if it doesn't provide you with actionable guidance to actually keep you safe? So I thought that story was a nice introduction into what we're talking about here. So that's really where Pape and What Now come in. What Now is being renamed as the IFRC National Society Preparedness Message Platform, but since I'll be referencing this a lot, I'm going to refer to it as What Now, since that rolls off the tongue just a little bit quicker. Another really fun title that we have is Pape. Pape stands for the IFRC's Public Awareness, Public Education for Disaster Risk Reduction, Action-Oriented Key Messages. We're really good at short titles here. So I will condense that down to just Pape. It's a 176-page comprehensive guide of trusted, verified safety tips for hazard prevention developed by experts. Whereas What Now is a platform developed by the IFRC, GDPC, and Google that hosts the safety messages that have been adapted by Red Cross and Red Crescent national societies to fit their individual local context. These messages are made available through the platform to media networks and communication channels to broadcast to at-risk communities. So the first edition of Pape was published in 2013 and enhanced for the second and current edition in 2018. It was a joint effort between the IFRC and Save the Children to develop these messages through a comprehensive, evidence-based approach grounded in decades of global disaster risk reduction experience. Pape is based on research showing that awareness alone does not lead to action. Case in point, my scrambling during my flash flood warning. People are more likely to take preparedness actions when they understand the specific steps, believe those steps are effective, and feel confident in their ability to carry them out. Working with social scientists, climate scientists, behavioral researchers, and humanitarian aid professionals, the messages draw on decades of field experience by IFRC, Save the Children, and their partners in disaster-prone communities, taking the lessons learned from past disasters to inform on what kinds of messages resonate and lead to action. These messages were co-developed with communities, local Red Cross, Red Crescent national societies, and other humanitarian actors. They're designed to be adaptable to local languages, cultures, and hazard profiles. The messages were tested in real-world settings and refined based on feedback from community members and practitioners, really demonstrating that these messages are verifiably backed and proven effective in communicating action guidance. These messages serve as a tool for Red Cross and Red Crescent national societies and partners to localize and adopt as necessary to scale up their work in promoting consistent and sustained safety and resilience related action to the public. The theory is that if these actionable messages are universally practiced, disaster risk can be substantially reduced and more lives can be saved. The framework used to develop the messages is based on scientific analytical research, which highlights 3 logical and consistent spheres of activity that emerge from a wide mix of household, micro, and macro hazard adjustment activities. These messages are structured in a way that helps people to think about the issues and to solve problems for themselves. The framework for the messages is linked to the activities that take place in society at large, so that action taken at home logically connects with advocacy, I can't speak, for action through work, school, community, and governments. The message activities, include assessing risks and planning activities to recognize, reduce, and respond to hazard, taking mitigation efforts to make the built and natural environments safer, and establishing early warning systems, and developing response capacity by learning skills and storing provisions. For messages to have credibility and strong impact in communities, they need to be adapted to local hazards, culture, and context. To help with the process, there are core concepts, which you can see right here under the key messages, which seek to be universal as possible. And they're complemented by operational details to the right here that may be context specific. So for example, in the US, we may say, make sure your car is filled with gas to be prepared to evacuate. While in Indonesia, they may say, make sure your motorbike is filled with petrol to be prepared to evacuate. The process for adaptation and localization of messages should be participatory with expert input to yield a set of messages that everyone feels comfortable to accept and jointly promote consistently. Drawing from this resource, the What Now platform allows Red Cross and Red Crescent national societies to work with national disaster risk management offices and other relevant partners to localize the messages for their area, upload, edit, and publish their messages across their desired hazard, language, and urgency levels, which are midterm forecast, watch, warning, immediate, and recovery. It's a system that allows national societies to directly manage their messages. The What Now API allows for communication channels and media networks to access these trusted and verified key messages to broadcast across their platforms, allowing for communities at risk for a hazard event to receive these messages and enabling them to take proper safety actions. A highlight of this work has been the partnership with Google that promotes these localized safety tips further through their SOS alerts that they show during times of crisis. So in a world experiencing increasing and more intense disasters, having access to information and actionable safety messaging is really vital to save lives. So the images we have here on the screen is what the PAFE guide looks like, and what the What Now alerts and What Now messaging actually looks like. So I hope they form a nice reference. Thank you.
Thank you, Rita. And yeah, it's a really great example of how you can see like how much more effective and alerts can be when they include this like easy to understand and easy to follow guidance for people on like what to do, you know, if like a flood or something else is coming. So thanks, Rita. And it's also great, interesting to know how much, again, like research and evidence, you know, this event is all about like science for humanity and for humanitarian action. And it's like PAPE is a great example of how it's not just like random messages, it's messages that are based on, you know, years of research, years of testing, and really good practice and in evidence. All right, that's all with our presentation, and now we can open up for your questions and discussions. So yeah, if there is something you'd like to ask, feel free to either drop your message in the chat or just, you know, unmute and speak up. And you know, we have 5 amazing panelists. So just, you know, when you ask a question, make sure you also mention whom you're addressing it to. Any questions?
We have one question from Ion.
Yeah.
Oh, yeah, I didn't see that. Go ahead. Yeah,
Hi, everyone. My name is Ian Olua, and I am calling from the US. I have a question. This is directed to Tara. In your presentation, you mentioned some of the solutions that you have and should be like making warnings that are timely and actionable. And so in the presentation that's Dr. Adegun presented, he mentioned about like providing these warnings on a daily basis. But in your own case, what do you think is timely notification with respect to your own project? So how would you define timely? Is this like twice a day, once a day, just based on your own research? What do you think would be the best solution to pass the message?
Yeah, thank you for your questions, and thank you for a chance to elaboration, because in my case, the timely meaning, because when we did our research, the most of the respondents, they were worried about like it's late or it's beyond already the disaster had happened, and then we got the warning. So it's more about just before the disaster, at least like if there's a seasonal flood projected, then it should be before, not after the disaster. That's what they experience most of the time. So it's the timely in meaning like before the event happened. So not the regular basis in my case.
All right. So just to follow up, in a situation where the notification is coming in before the disaster happens, but what if, as at the time it comes in, little to no action could be taken and the disaster starts?
Yeah. Can you elaborate again?
I mean, your response was like, they should get the notification or signals before the disaster happens. And so what if it comes in definitely before the disaster happens, but not enough time to provide them, the rescue, saving themselves or like fleeing the disaster and, such environment like that. So just
that's always the challenge, because I think most of us here are working in the humanitarian setting. So that's the beauty or the difficulty of this disaster scenario. But always it's better in advance. But in our case, it's mostly reported like we are not getting even before the disaster, the message that should be intended before the disaster is coming after the disaster. So it's better, the earlier the better. So I don't have, because this exploratory study, I don't have any critical comments on like what could be the right time or what is the best timing, but it's earlier the better would be my remarks for your question.
Thank you so much.
Yeah, and it's also vastly depends on a hazard, right? There are hazards that you can predict, like drought, you can predict it and forecast like months in advance. Floods, you can also have sufficient lead time sometimes. But there are like things like earthquake there where you cannot predict it more than like 5 minutes before it happens. So I think it also depends on on the hazard that we are talking about. Thank you for your question.
Can I add on that? So I think that's kind of the beauty of the what now messages, being able to be adapted to different time frames. Exactly what Vlad said. There are sometimes hazards that are no warning events. So it happens, there's immediate impact, there's an immediate shock. And so people need to receive guidance in how to respond in the immediate and how to respond in the recovery phase as well. So I think that's the beauty of the what now messages, is that they are contextualized based on the needs of the individual time frames. So, there's the forecasted, there's the watch, there's the warning, there's the immediate, and then there's the recovery. So being able to really capitalize on understanding what actions need to be taken during these timeframes is really critical.
But I think it's just mind-blowing that both Tara's and Raphael's research showed that oftentimes people received early warnings when event already happened, right? Like it's a little too late. And I think that's what's concerning, that information reaches people when they already kind of experiencing the impacts of a hazard. And if someone else has something to add, again, it meant to be a discussion, so feel free to jump in and share your thoughts and ideas as well. Do we have other questions?
If there's no question from audience, I have a question for Rita, if I'm allowed to do that.
Yes, absolutely. You're part of the audience.
So, because I really liked what you present as a researcher, my broader area of research is like more behavioral intervention, and education is also what I do. And some of my PhD students are doing the similar intervention in setting, but not in disaster. I like your presentation that given the strength of what now, right now, the what now framework is clear and it's actionable. You said many times about like it can be adaptable and the country mission or societies can use it. So has there been any like examples, like has there been used for vulnerable populations, or in my case like people living with NCDs or similar last mile communities? Do you have any such example that you can share, like it has been tailored or the efforts has been done to contextualize it? Can you share such anything?
Yes. So I think currently we have 20 national societies who have gone through the full process. So we have 192 national societies that we work with. So there is a mountain of work still to be done. I think the biggest challenge is that this is a relatively time-intensive process to get all the relevant stakeholders in the room and willing to commit the time and effort to develop these or to contextualize and adapt these messages. So that's really the biggest hurdle, is the coordination of the efforts. I think once you get the relevant stakeholders on board to be able to sit in the room and do the work, commit to like a 2-day workshop to really get down into the nitty gritty of adapting these messages, it is effective. But it's the lead up that is a very time intensive process and can be challenging to overcome.
Yeah, that's like an ideal scenario, but at the same time, those messages they're available online, and if like any organization or NGO wants to use it for like that, and it's not only for early warning systems, it's also for risk education, to kind of use it in training and different, program curriculum development around disaster preparedness. So those messages are very effective and give, good foundation for those kind of risk education programs.
Thank you, Rita.
We have a question in the chat from Ainur. Ainur is asking, with what now, is there a way for individuals to reshare actions with others in their own social networks? Have any national society tried to promote this type of social sharing of the what now messages after an alert?
I don't believe, I'm not the what now expert. I focus more so on the PAPE side. And what we see beautifully done, I think, through Google and through a lot of social media, through the Facebook, through Twitter, now known as X, you have the opportunities when you are localized to be able to mark yourself as safe. And so I think there is a lot of social sharing on that regard. I do want to highlight that we are doing a really exciting initiative right now with national societies on using the PAPE messages for social sharing. So we're in the process right now. It's a PAPE video competition. So the results of which will be out in just a few weeks' time, but basically engaging members of national societies to develop social media videos, 60 seconds or less, using the PAPE messages to be able to communicate effective preparedness actions for people to understand what actions to take in different hazard scenarios. And with those videos, that's the beauty of social media and social sharing, is that they can be proliferated. And I think that's a big thing that we're trying to curb and address, is the myths and disinformation that we're seeing around the globe on what actions to take. So by putting out trusted and verified and consistent actionable safety guidance, I think is something that we're really trying to push forward and help to national societies to engage with communities in this new wave of digital media to be able to share sound preparedness guidance.
Well, thanks, Rita. We have time for one, maybe two really short questions. I'm dropping the link to the evaluation survey in the chat, so please, before you leave, or after you leave, just fill out this survey. And we have another question in the chat. Given there are trends now to use AI models instead of traditional search engines, is anyone working in the area of ensuring AI models have access to up-to-date data and provide accurate advice? I don't know who wants to take this question. We can all just weigh in a little bit, but I do not know. That's actually a really good point that, when people use ChatGPT to search for information, like it's really important to ensure that ChatGPT provides reliable and accurate advice. So yeah. And yeah, just curious what this audience thinks. So feel not necessarily panelist, if someone wants to share their opinion about that, feel free.
I don't really have an opinion on that, but I have maybe an example. I think here in Brazil, we have the National Center of Early Warning, Monitoring of Natural Hazards, and the division that works researching landslides. They recently released a platform called GeoRisk, and this platform is using AI for nowcasting of landslides in the Green Coast, in this area where I worked. So I think, well, I can share the link. It's an example of technology using AI for predicting landslides.
Yeah. Very useful.
Maybe I have a thought. Thanks a lot, Eleanor, for your question, because it scared me that when I first read it, I was like, yeah, it's true. Like many people now is using this as information retrieval. However, I think it will be a super nice research area to be to first just to know if that's really the behavior of someone that it's in panic mode, because I think we know that we can use these LLMs to know general topics, but all of us, or most of us, we have this understanding that we shouldn't trust it for information that is up to date, even if it has access to the web. So I think that's a great point, just to research first, to know better that area of behavior, like behavior of people, to if they will be inclined to search this type of information there. And then the second part will be on advocacy for those, because yeah, I don't know. I don't know what can we do from the area. Maybe our national societies can really try to tell to their communities to take care and to always kind of go to these official sources. But also, I guess that we need to make this advocacy with these tech companies, right? Like for example, with Apple, with different providers, there have been discussions to enable that alerts arrive kind of from in a different way, that other information, that it's really prioritized because it's alerting, it's really important. So I think that in a way, we have the same argument. We could do the same argument to talk with these LLMs companies, so that this information that is from alerting is treated differently.
Yeah, for the longest time, like social media algorithms were a mystery to us, how they're pushing and promoting information. Now that AI chatbots algorithms are also a mystery, how they select like sources to reference and all that. Well, thank you again. Unfortunately, we're at time. Thank you again to all the panelists for their presentations. Thank you for all your questions, and thank you for joining us today. Again, I'm sharing slide with the evaluation survey. Either scan the QR code, or I also put the link in the chat. Again, thank you again, and hopefully you'll attend a few more long night of research session, and have good night, have good rest of your day. Again, thanks everyone.
Thank you.
Bye.
Bye.